what percentage or proportion would you say of Stillwater Med Center patients in general would be Sooner Care, Medicare in general?
Roughly about 30%. So quite a few. Probably what I shared with you was about Stillwater in general, that we have a very high percentage of our population that depend on Medicaid to access health care. That's where they get their insurance from, and so it's a huge piece of Stillwater. And I would go as far to say that's pretty common in rural Oklahoma. That some rural areas, Stillwater is a fortunate area when it's considered rural because we still have a decent amount of commercial mix in our landscape, but in some of rural Oklahoma, they're in like 80% plus of their payer mix will be either Medicaid and Medicare, like a combination. They'll be north of 80% reliant on governmental payers.
Having that stability up to this point, what has that allowed hospitals like yours?
So when Medicaid expansion was put in the state question and passed and put in the Constitution, that added roughly 250,000 Oklahomans. They had access to health insurance that they didn't have, and those were working Oklahomans that didn't make enough, that they qualified or they made too much to qualify, but trying to buy insurance was too costly for them, and so it really provided access to health care for so many working Oklahomans.
Simplified it.
Huh? Yes, simplified it. And so if it were to not be a part of or allowed in Oklahoma anymore or moved to a statute and drastically changed, then that's just more people that struggle with access to get to the care they need, to the physicians they need, the specialists they need.
A lot of criticism to this that I've seen from politicians will say this opens the door for fraud. When you consider the risk reward, at least in your hospital, from what you see from partners in other hospitals in Oklahoma, is there merit to that? Is there any risk to the reward of people having guaranteed insurance?
Well, I think there's always a potential for fraud in any system, and that's incumbent on us making sure that we have systems and leaders in place at our state and federal level to make sure that we can't abuse systems and abuse taxpayer dollars. They need to be used for what they're intended for, but I wish I could say that there weren't bad actors in the world in our state, but I just ran across a conversation this morning in which a DME company was engaging in fraudulent activity. But I don't think it would be fair to take away that access because of potential for fraud. I'd rather us build better systems to prevent fraud.
If those at the state capitol, and by the way, passing the House 74 to 18,
right.
That's a big majority.
It is.
I assume you have the same opinion of what the OHA sent out in its statement being opposed to this, by the way.
Mm-hmm.
What are those 74 state leaders missing?
You know, I think potentially, missing, I don't know that I'd go as far as to say what they're missing. I think the state leaders are looking at what their ultimate responsibility is, which is to make sure that they're balancing the state's budget. I think what they may not be aware of, or at least really understand, is the delicateness of the Oklahoma healthcare system and the infrastructure throughout this state that really depends on Medicaid. The last time you and I spoke, we were talking about the Big Beautiful Bill, or H.R. 1, and so it has already been put into action and law that we're going to see massive cuts across the nation and in Oklahoma that are going to really start taking effect in 2028. And so everything the state does on top of that just puts more Oklahomans at risk and hospitals at risk. We talked about the hospitals that were at risk of closure. There's like 40-something now that are at risk of closure and like 20-something that are at risk of immediate closure. There are hospitals today that are struggling to make payroll. And so what happens when hospitals close, when systems close? Like, what's going to happen to the health of Oklahomans?
You're saying this bill could lead to something like that?
I think every day it's getting harder and harder to make the math work at a local hospital health system level. And yes, I think these cuts could absolutely be the pebble that falls over the last rock, if you will, to fall over that causes a hospital to close.
So if this indeed comes to the power of the legislature, you believe we could see some contracting in the budget. If that happens, you're saying fewer people get guaranteed insurance. What does that mean for your hospital?
So depending on the level of reductions, I just held employee forums with our entire team and talked about HR 1 and how many potential dollars that means for us, and that we've got to be prepared, and that's even before Medicaid expansion changes at the state, that we've got to try to figure out how we're going to change how we provide care, Samson, because if millions of dollars are taken from Stillwater Medical and redistributed wherever they're redistributed, then we cannot continue to provide the same level of resources and care that we currently provide. We don't have a plan of what we will cut right away. I want us to be able to explore that as a team, but at the end of the day, if you have less to take care, if you have less to invest in nurses, physician, technology, we'll have to figure out how to provide what we can provide with the resources that we have.
So I want to make sure I get the main statement that you want to proclaim if this goes through, if this becomes law. If this is taken out of the state constitution, people are more likely to what?
To not have access to the care that they need, at least close to where they live. So if someone, like in some rural areas, there is a physician to 20,000 people. So if you think about, is that likely that they get in to see a physician, even if they have insurance that's not through Medicaid? Every cut to healthcare is a reduction of investment in healthcare. And so if we keep reducing our investment in healthcare at a federal level, at a state level, there will be less healthcare, less access to physicians, specialty centers, cancer centers, and we know those things increase our livelihood, our longevity. So at some point, you cut and cut and cut, there will be a reduction of services.
For the most vulnerable first?
For the most vulnerable. That's where we're cutting right now, is Medicaid, both at the federal level and now we're talking about it at a state level. And so yes, the most vulnerable first.
Have you or any of your colleagues in other hospitals been able to speak with state, House, or Senate leaders about this?
Yes, I do think there's been conversation. It's a little different than the last time. That was such a under the gun type of thing. But yes, I do think there's conversations ongoing, and very thankful for the Oklahoma Hospital Association, the Oklahoma State Medical Association. So we had Medicine Day at the Capitol I think that was last week. We'll be at the Capitol next week for Oklahoma Caregivers Day, and yes, we've been able to schedule visits and be able to communicate with folks.
The House voted 74-18 on this Wednesday, I believe, so you're going to have more chances.
Yes.
Is the situation becoming kind of dire regarding this?
Yes, that's a strong word, but I do think that the finances of healthcare are getting pretty dire. There's so much, and it's kind of we're at a point in what I'm going to say, the healthcare landscape. There's so many neat and inventive things happening in healthcare, but those things, just like anything that's going to thrive, take investment. And yes, I do think it's dire. I just gave a presentation to my board last week about the workforce challenges that healthcare is going through. Not only are all these state and federal cuts happening, but the youngest boomers are nearing retirement. And so many of the boomers, the boomer generation, are at the time where they need health care. And they're leaving the workforce, and so there's not as many nurses, physicians to take care of all the boomers, and so the pressure, the cost of goods, the cost of talent, physicians, nurses, techs, the pressure of healthcare is, I would say, at an all-time high, at least in my career. So every cut means huge things.
Including what this could mean contraction of Medicaid, aka sooner care.
Right, at a time where our largest generation might need it the most. Yeah, our boomers.
Curious if you've been able to speak with him or his colleagues, or if you could, what would you say about this? It's his bill.
Yeah, I mean, I'd say, one, I'd want to, and I haven't had a chance to speak with him personally. I hope to be able to do that next week. I would want to have a conversation with him to make sure that he really understands, what could happen, the ramifications that could happen, and be there to answer any potential questions that he might have. Samson, I always think about, I've never served as the Speaker of the House for our state, and so I don't know the shoes that he's in, and I don't envy any of them for having to try to balance the budget, because I know in my line of work it's hard to balance this budget. And so, but at the same time, I look at, just all the things that we spend money on and think surely there's a way that we could work together. My favorite time serving in this position is when legislators reach out to the people in the industry to find out, hey, what do you know? What can I do? And I was.
Have they done that for this?
Not well. They could have. People may reach out like that, but so I honestly don't know. But I think that leaning on the people that are in the industry, whether it's a healthcare decision, an education decision, whatever decisions that are happening in the legislature, I think that's important. And so that's what I would want to know and ask him that he had done that.
Is there anything else regarding this student care in general that I haven't asked that you think is important to mention for this story?
I think I've mentioned it, but I'll say it a little differently, that rural areas are really vulnerable, and any of these cuts will make them even more vulnerable to where we will lose access to health care. And that people living in metros, that eventually comes and the tail swings, and it affects the metro areas too, because where there might be easier access in a metro, if all the people that live in rural Oklahoma are now having to drive in to access care, it affects all of us. We all need all this infrastructure, if you will, all this access to physicians to be able to make every community, whether you're metro or rural, work. And so it affects all of us, and we should all be involved and stay attention and let our voices be heard.